because if you were a dentist or kind of in my field, there is no cosmetic dentist you go and get a degree in doing cosmetics. Because the giggle that you get from when you talk in the dental society would be a situation like this. Well, it's all cosmetic. Everything we do should be cosmetic. I mean, ultimately that's your goal, is to have a result that is going to function well, last a long time, but look very good. And if it looks good, it's usually functioning good. And so, so saying you're a cosmetic dentist just means to me that I've spent extra time in studying what is an aesthetic smile, how do we recreate that with the different restorations that we have available to us, what are some of the limitations to getting the results that we want, and being sure that your patient can understand that they have some limitations based on their smile. Not everybody's going to look like Brad Pitt or Angelina Jolie, you know, we never will. But what are the things that we can do to really enhance their personal smile and their personal uniqueness that people go, wow, you got a great smile. And that has to do with color, it has to do with shape, it has to do with, you know, even how it looks in the face with the structures around that. And to really study that before you jump into something. And both on my part and for the patient, because I want them to have a great result and I want to feel really good about what I do as well. So we study it a lot, and we do a lot with what we kind of call mock smile trials. Sometimes we can do that with where we start out with taking some molds of your teeth, making sure the function's right and that we can correct that, but then what is the least invasive and least costly way we can get the results that we want. Sometimes that might be lightening your teeth, which if we want to go more into specifics of what is dental whitening, there's a lot of things where you can go from anything over the counter that can get some results for some patients. But the thing that I would urge a patient to be sure about before they would go down that avenue is are their teeth healthy enough to lighten in the first place? You know, there can be some discomfort that can come from that if you're trying to lighten teeth that have cavities or other issues going on. So what I would recommend, what we can do with that though, is there's anything from in-office whitening that you can do with more powerful bleaches and light and things like that, to take home you know, trays that you can do and maybe lighten on a slower way. And I think each of those individual ways of doing it is more specific to what the patient's needs are. There are definitely some contraindications to lightening your teeth. If you have a fair number of fillings or crowns or things that have different colors, if you have crowns or veneers or a tooth color filling in the front of the mouth, it's going to stay the same shade because it was matched to the shade that you are now. So that might be a situation where, well, if I lighten my teeth, then some of these other things might have to be replaced. And you need to be prepared for that. And if that's what you want, then that's fantastic. Then we can talk about what's that treatment solution for you specifically that's going to give you the smile that you want. So in some situations, a crown, people think, what is a crown? There's, you know, when they think about a crown for cosmetic reasons versus a crown for, you know, a functional reason or a tooth broke or whatever, it's still the same thing, okay? What a crown is where you build an adequate foundation underneath that tooth that's healthy and secure and strong, and then you remove just enough of that off all the surfaces of that to have enough room for that crown to be there. And sometimes we can do what we call instant orthodontics, or by how we design those crowns, we can actually make a smile look like it's straight even though the teeth underneath it aren't. You can't always do that. Sometimes we do have to have orthodontics be part of that process. And so that again goes back to how much we study up front. What is it going to take to do that? A veneer is something that, when you think about a veneer, is more like a fake fingernail. Women know that real easily. You just put something on over, and it's like or in a ghost town, you know, where they do a old Western movie, and you just there's nothing really behind it, but it's just facings of the store, and what behind it isn't really seen. But you're giving that creation of that full smile with just a facing on the tooth. They can be done with either laminate veneers, which is more of a ceramic. Can be done with composite, which is a tooth-colored filling material. And there's, pros and cons to both of those as far as, one of the things is one is more costly, but it's also going to look good longer, So we have to go through all of those options with our patients to determine what fits their budget and what fits their need. And I always feel, which a lot of my colleagues feel, is the less amount of dentistry that we can do that gives us the result we want is the best dentistry you can do. The reason why it's important to try to do as little dentistry as possible is that we need these teeth for a long time. And when we have to do things that involve more of the tooth, that because they don't last forever, okay, and that's something else that people like to know is, well, how long is this going to last? If you think about fillings or other things that you've had in your life, in the back of the mouth or whatnot, this type of dentistry is no different. It has to withstand the forces in your mouth, the acidity of foods that you eat and drink, how high a cavity rate you have. So for somebody to want to make an investment in this, they should make the investment of having a very healthy mouth to start with and know how to maintain that. And that's part of our job, is to teach that. I've seen cases that people have had done that I've inherited, that have lasted 30 or 40 years. I've had some that, wow, they only got to 8 or 9 years on some things before some things started to break down. And some of that is because of bad function, bad choices by the patient on food and habits. They use they're a fisherman, and I decided to use this as cutting my line. We can't do those things and expect things to last, just like our teeth don't if we do those kind of things. So there's a lot of education, and if you want to make this investment, how to make it last as long as possible.